Welcome everyone. On the third episode of Breaking the Myth, we have Dr. Dibyendu Kumar Ray. He's a senior consultant and HOD of the Department Neurosurgery at Manipal Hospitals Broadway, Kolkata. Sir, welcome to this episode on the Brain Tumor Day that is going to be acknowledged on 8th June. On this occasion, love to be here with you. So my first question, what is brain tumor, sir? And is it a very serious or not?
Good morning, Trisha. Yeah, brain tumor is a serious condition, but maybe there are, conditions which are not so serious as others. Brain Tumor Day is celebrated on 8th of June to raise awareness amongst the general public about brain tumors and dispel myths regarding brain tumors.
Sir, as you previously said earlier, what type of brain tumors which are more or less serious than the others?
See, brain tumors are basically classified in 2 or 3 ways. One is primary brain tumors and secondary brain tumors. Primary brain tumors are those that arise from structures in the brain. Secondary brain tumors are those that spread from organs outside the brain. Brain tumors are also classified into benign and malignant tumors. Benign tumors are non-cancerous. They grow slowly and mostly they present with features of mass effect, that is, features of compression. Malignant brain tumors, on the other hand, grow rapidly and spread fast. Then they spread into the interparenchymal planes. So, secondary brain tumors, which spread from other organs of the body, are by definition malignant brain tumors, otherwise they wouldn't have spread from other areas of the body. Primary brain tumors can be differentiated into benign and malignant tumors. Benign tumors may arise from different structures of the brain. They may arise from the meninges which are covering the brain. They are called meningiomas. They may arise from the lining of the ventricles, which are ependymomas. They may arise from other, oligodendrocytes in the brain, that dendrocytomas. They may be malignant. They may arise from glial tissue in the brain, which are called the gliomas, the astrocytomas, and they may arise from the coverings of the cranial nerves like schwannomas. So, they're classified into different types. The primary brain tumors, which are benign, they're normally present with features of mass effects. They usually have a better outcome and are resolved by surgical extirpation of the lesion or any other management that's deemed fit by the treating clinician. The secondary brain tumors, if they are solitary, they are treated with excision followed by adjuvant chemotherapy or radiotherapy as deemed fit by the clinician. Primary malignant lesions of the brain usually require surgery for tissue diagnosis, surgical debulking of the tumor, and reduction of mass effect, and better results after adjuvant therapy for primary malignant brain tumors.
Surely, sir. Like you were giving us a medical way of understanding what and how and what type of brain tumors are. So as a patient, when I come to you, I know nothing about what is brain tumor, or how can I be aware of brain tumors, or I can make it in an easier way that my brain tumor get a good solution. My competency as a patient could be higher. So, sir, as a doctor, when I come to you, I'm in a first stage. A patient knows first stage, second stage, third stage, and fourth stage. Me being in a first stage, I come to you, sir. How would you guide me?
See, first, you need to come to me. So, what are the symptoms that you may be suffering from when you realize that you need to see a clinician? If you have a headache that refuses to go away, if you suddenly feel that slowly your hands and legs on one side of the body are weakening over a period of days or weeks, if you feel that you are slowly developing weakness of one side of the face, all these are slow developments. You must realize it's not stroke, but it happens suddenly. Or you have never had seizures, but in your adulthood, you suddenly develop seizures, convulsions. Then you need to see a doctor. Probably you may have something going up there which needs to be diagnosed and treated accordingly. If you have a tinnitus, if you suddenly develop hormonal changes, then there could be something going up there and you should see your doctor. Your doctor will be the best to guide you. He will run a clinical examination, then some other investigations to diagnose what you have and treat you accordingly.
So, as if I have a brain tumor, let's say, will my children or my grandchildren would be having the same brain tumor?
See, certain types of tumors have a genetic predisposition, but it is not that they are surely going to have. Your first degree relatives of patients with brain tumors need to have a lower bar to getting a physical examination by a doctor or a medical examination to rule out brain tumors at an earlier stage.
Surely. So, if I want to prevent brain tumors, so what are the prevention methods that we can take?
Well, the well-known method is to prevent exposure to radiation, ionizing radiation. Other than that, there's hardly anything that we know which will surely help you prevent brain tumors.
Surely, sir. So, is brain tumor seriousness on the effect? Is there any strong effects a patient gets before we consult a neurosurgeon or we detect that it's a brain tumor?
Well, it depends what the clinical location of the tumor is. A patient may be suffering from intractable headache and vomiting. A patient may be developing weakness of one side of the body. Patient may be losing hearing or vision. A patient may be developing convulsions. It depends on the site of the tumor, the type of tumor. It is variable and varies from person to person. So basically, if you are having the symptoms that we have discussed, then it's better to see your doctor who will be able to advise the relevant investigations and diagnose you appropriately.
So, as a doctor, would you suggest some precautions that we can take, in dietary or in exercise or?
Well, there is hardly anything in diet or exercise that's going to prevent brain tumors, but I'd always recommend a healthy diet, low in saturated fats, moderate carbohydrate intake, low refined sugars, and an active lifestyle. That is obviously going to give you more to life, but I cannot say that is going to prevent brain tumors. The only thing that is known to prevent brain tumors is avoiding exposure to ionizing radiation.
Thank you, sir. It was a lovely conversation to you. And as I said earlier, that on the occasion of 8th June of World Tumor Day or the brain. So yeah, thank you so much.
Thank you, Trisha, for the interview. Thank you so much. I hope I can do my best to raise awareness amongst the people so that we get to see patients as an earlier and more manageable state rather than at a later stage where everything becomes unmanageable.
Charles, thanks.
Thank you.
Thank you for watching this video. If you have any comments, please do write it below. Our doctor with time will be coming with the answers for the same. Signing off. Bye.